I saw one of your stories about ivermectin, and that's obviously something that's been very ridiculed, and it's been pretty one-sided in my opinion. Um, and I've looked into the primary research. I've looked into other experts like yourself, who have different opinions on it. Some people who think that it's not beneficial, some people who think it is really beneficial. Um, but like you said, simply because we had to, not me, right, but physicians had to act fast in times of COVID, and we didn't have treatments available at the beginning, right? And you had to get, in a sense, sort of creative and weigh the benefits against the potential costs. You had to act quickly, but for some reason, even if physicians had a hard time, or found that ivermectin was actually working for some, if not many, of their patients, they still were ridiculed because there was no randomized controlled trial for it.
They were. And it was tough because I actually got in trouble at a couple places I worked for prescribing ivermectin. I got in trouble for prescribing fluvoxamine. And I had read the data. It's not like I don't do something because somebody else tells me, oh, you should do this. I'm not that kind of doc. If I'm doing something, it's because of my personal interpretation of the data I've read. And it was like that with ivermectin. There's a website, Ivermectin, who aggregated all the data. The problem is that people were using ivermectin in lots of different ways. They were using it pre-exposure, early on, 5 days after, and then all the protocols were different. And so you'd see a study that said ivermectin didn't work. And then I look at that study and I said, oh, on average, they started people on ivermectin 5 days after symptoms started. Well, of course it's not going to work. I mean, that trial is designed for the drug to fail.
Right.
Because the virologic phase for COVID lasts about 7 days. So if I'm giving you a drug on day 5, when you're about to clear the virus from your body, it's not going to work. The strongest data with ivermectin was for prophylaxis, pre-exposure, and post-exposure, and early intervention. And the data, the effectiveness decreased, right? From prophylaxis to post-exposure to early treatment, right? It was more effective for prophylaxis. The problem is that a lot of that research wasn't done in the US. And a lot of docs don't trust foreign research. Well, I trust foreign research. I've met tons of foreign doctors. I train with a lot of them. They were way smarter than me. Way smarter. I wouldn't be who I am today without the work of a lot of foreign doctors I've met with and trained under. So it was one of those things where the response was absurd. Like, you have a medication that won a Nobel Prize that for years has been touted as safe, all of a sudden became dangerous, and you're a rogue doctor and they were coming after your license for using it. That's crazy. I understand you don't want doctors doing stuff where there's no data behind it. But if there's lots of trials and aggregation of trials showing effect and minimal risk for something that we, at the time, we were still figuring out, why not do it? And then my other problem is that I'm never going to give you a medication and say, here's a med, this is your best bet, or a vaccine, say, here's a vaccine, here's your best bet, good luck. No, I'm going to tell you exercise. I'm going to tell you eat lots of antioxidants, drink plenty of water, get sleep, do some mindfulness, do some stress reduction, because all of these things are going to give you your best odd. I always tell people, you cannot depend on medications to overcome your lifestyle. And we've seen this in time and time again. There was a study recently, a meta-analysis on statins, that showed that the all-cause mortality reduction of statins for primary prevention, meaning preventing a heart attack, was like 0.8%. It was like 1 point something percent for heart attack and like 2 point something percent for stroke. That's it. Now, for lay people, that means if you take this drug for primary prevention, the data is showing to prevent death from all causes, that about 99.8%, 99.8 out of 100 people who take it, or 99.2 out of 100 people who take it, will see no benefit. That's crazy, right? If like the public knew this, they would never take that drug. on the best case of preventing stroke, you've got a 2.4% reduction.
Right.
2.4%. Are you going to place not having your stroke on a 2.4% chance? Nobody's going to do that.
And there are
You're going
probably
to say,
side
well, what
effects
else?
too, right?
Yeah. And the side effects. So if you're looking
Yeah.
at this, the number needed to harm is about the same as the number needed to treat. That's bad medicine.
Wow.
That's bad medicine, right? So these are cardiometabolic diseases caused by lifestyle. Lifestyle is the answer. So again, you know, medication, yes, I believe in appropriate medication usage. I believe if there's data behind it, we've prescribed things off label, meaning not FDA approved forever. All of a sudden it became a problem.
Mm-hmm.
But at the same time, don't just give people medication, give them vitamin D, very important for your immune system. Exercise, very important for your immune system. Sleep, very important for your immune system. And there's studies on all of this. One study showed that, I'm going to butcher the numbers here because I don't remember them exactly, but those who had a higher quality nutrition plan had, I think it was like a 41% reduced chance of going to the hospital for COVID. That's an astronomical number.
Yep.
Right. And you didn't hear anything about that. Eat well, prevent COVID. Right. So again, use a medication if it's appropriate, if there's data behind it, but also give them the non-medication stuff, which is way more powerful than medication.